Our goal is to make sure that there's beer and wine sold in, be it the big retailers, the Costco's, the Walmarts, Loblaws and Sobeys and Metro. I think I covered everyone almost in those stores, and the convenience stores. So we're going to fulfill that promise. We've expanded it tremendously since we've been in office. And there's a certain percentage that we are able to hit. But at the end of the day, we need to have convenience for the consumer.
That's Premier Doug Ford there, wanting to expand the sale of alcohol in the province, making it clear where he and his government stands. But the Centre for Addiction and Mental Health says this is a move in the wrong direction. For more of this, we're joined by Dr. David Greatzer, attending psychiatrist at CAMH. Dr. Greatzer, appreciate the time this afternoon. So CAMH is coming out saying this is the wrong direction. Why is this? What is so wrong about this?
Well, we consider this move to be something of a game changer. We certainly understand the government's position, but it's not just about convenience to consumers. We have to think about this from a public policy perspective to state the utterly obvious. Alcohol is an addictive substance, and when you make it so much more accessible, we're going to see more problems with alcohol and alcohol-related deaths, and we're saying, wait, we need to think this through.
Mm-hmm. So this isn't specifically about whether or not people are going to be 19 and have their IDs checked or something like this. This is more along the harms of the potential harms of what alcohol can do by making it more accessible, therefore easier to come by effectively.
Well said. I'm not sure I've got that much to add. Look, already you see sales in liquor stores, LCBOs, of course, but this move to add convenience stores, wow. I mean, there's 7,500 convenience stores across the province. That would mean perhaps 250% more stores selling alcohol. And again, we would suggest we need a little bit of caution here, because we know from the BC and Alberta experiments, when you have more stores, you have more consumption, and yes, you have more people running into trouble with their alcohol.
How much more, Dr. Greatzer? How do you measure that? Because I'm curious, because we often think of Ontario kind of in isolation, but as you point out, it already happens in Alberta, it already happens in British Columbia. What are the realities or situations in those provinces?
Well, when you look at British Columbia as an example, you see that there have been far more stores. And every time you have new stores opening up, you can measure the increase in consumption. You can even measure, in fact, alcohol-related deaths. So this isn't just our opinion. This is drawing on the evidence. But I also want to say that the moment is the wrong moment. We've gone through a huge pandemic, as you know, and some people have turned more to alcohol. We know, in fact, sales of alcohol soared at the start of the pandemic, 38% in the first 2 months. We worry that those who are the most vulnerable amongst us will be drinking more. And I can think of a patient or two who've struggled with alcohol through the pandemic. Wow, I worry about the implications here.
Mm-hmm, certainly. And I also understand at the same time as you're talking about the concerns over the potential expansion in the province, you've also put out some research about the Canadian Alcohol Policy Evaluation Project, evaluating the controls nationwide. Ontario getting a failing grade, and Ontario's grade not only failing, but it's dropping.
If your son came home with an F in math, you'd be concerned. We have rated the different provinces. This is a research project started at the University of Victoria, where we look at things like access to alcohol, taxation, enforcement of rules. And yeah, we get a failing grade here in Ontario. And again, it's not ideal. We're coming out of a pandemic. Alcohol, like tobacco, needs to be taken seriously, needs to be regulated and taxed. I hate to be the adult in the room, sir.
Okay, what then would CAMH put forward as a solution then? I mean, clearly you're talking about more restrictive, sale of alcohol. How much more restrictive? What should change in this province then?
Well, we would start by not dramatically expanding to the possibility of every convenience store in the province. I mean, this would be such a game changer. Work in downtown Toronto, there's the possibility that so many corners, street corners, would have all of a sudden an ability for you to buy beer. It's too much access. We would suggest we look at other things like enforcement of current laws and regulations. We would even wonder about taxation. Again, I appreciate people are stretched as it is, but alcohol, tobacco, these are not innocuous substances. They're linked to cancer, death, addiction. Hold on a second here. Of course, you should be able to enjoy a beer on a warm summer's day. But what we're suggesting is such availability, we're going to run into public health problems as a result.
All right, Dr. Greatzer, appreciate the time this afternoon, and attending psychiatrist at CAMH. Thanks for joining us on CP24 Live at noon.
Thank you, sir.
Okay.